Everyone, my name is Ashish Rahi, Assistant Professor, RPIIT Institute of Pharmacy, and today my topic is about how to reduce the nosocomial infections and hand hygiene and infection control. The hand hygiene is very important in infection control. That is the main function of the infection control committee. How to maintain the hand hygiene? We have to following techniques: provide sinks, clean water, and soap at the location, and hand washing. Where hand washing are unavailable, we can use the alcohol-based sanitizer or any other hygienic techniques. We should monitor the compliance of the infections, and we should also use gloves whenever necessary while dealing with the dirty works or any other infection related to the patients. And how we can ensure that the environment is clean. For there we have to establish the policies and procedure to prevent food and water contamination. There should be regular schedule of hospital cleanings like wards in operating theatres and laundry, and they should be disposed of medical waste safely like needles and syringes and other infected wastes can be incinerated or autoclaved safely. And we should there be extra bags and isolated soiled linen from normal hospital traffic. There are some precautions for the isolation and standard precautions used dealing with the infections. Wherever possible, avoid the crowding wards and implement specific policies regarding communicability like private rooms and bars for the that particular type of patients. And there should be a very policy like scheduled time for that, like 1 hour in morning and 1 hour in night. There should be hand washing and use of gloves should be mandatory. And gowns wherever possible should be used. Mask and eye protection should be used. And the precautions with sharp instruments and needles used safely. And there should be cleaning, disinfection, and sterilization of instrument and supply should be used. Like written policy and procedures are needed for that. Steam sterilization should also be needed, and quality control process like sterilization parameters, time, temperature, and pressures, and biological indicators should be used. Sterilized items should be used in enclosed clean area. So these are the safety and the precautions which we can use by handling infections and disinfection and cleaning in hospitals. Thank you.